All right,
All
well,
right.
go ahead and get started here as others come on in. Welcome. My name is Lynn Lucas. I'm with the early education team at Children at Risk, and I am joined here by Kim Coffrin, our Executive Director of Early Childhood Education at Children at Risk. And we are excited that you have all joined us from the Alamo, San Antonio area for the April 2026 Texas tour. We always have new data to share with you, and today is no different. So we're excited to spend this time with you. Um, the trajectory of our time together today, it's split into three different sections. And so I'll lead us through the quality section. We'll talk about quality, and then Kim will escort us through the access portion, access in terms of childcare deserts to childcare facilities. And then Kim will also escort us through the policy section. We very much value and invite your engagement throughout the session today. You can do that by coming right offline and talking out loud. Feel free to put things in the chat. In addition, do note that at the end of each section, we are going to ask you to participate in a Zoom poll that will come up on your screen. We'll give you a few minutes to fill that out, and then we will share the results with everybody and invite you in for continued conversations. The mission at Children at Risk is to serve as a catalyst for change to improve the quality of life for children through 5 different avenues: strategic research, public policy analysis, education, collaboration, and advocacy. And we appreciate all the efforts that you also put into those avenues of making a change. This is the rest of our Children at Risk team. They do work both in front of and behind the scenes, and some of them may look very familiar to you. We could not do this work without them or without you. If you're not already a part of the Texas Prenatal to 3 Collaborative, we encourage you and invite you to do so. You can join by grabbing that QR code. We have a quarterly meeting that happens 4 times a year, and also a newsletter that comes out bi-monthly. We hope to see you there. By the way, speaking of the QR code and the slides, you will receive a copy of the slide deck. And so if there's QR code or information that you didn't get to grab, don't worry, that will come around to you in a follow-up email. So now that we've made it to this point, let's dig into childcare quality. We receive funding to support childcare quality through all of our programs that receive subsidy in Texas. And each local workforce board has quality dollars that are set aside to put toward some of those efforts. And we do that work through Texas Rising Star. So what we're looking at here is how each workforce board spent their quality dollars. And what we're looking at is the Alamo Workforce Board, and we're comparing 2023, which is in the red column, to 2024. Now, this is 2024 board calendar year. So that year actually ended in September of 2025, just to note that. It is interesting to look at the differences between how Alamo spent quality dollars in 2023 versus 2024, because although TRS was not new in 2023, it was definitely kind of like chugging up the hill. In 2024, that was the year where TRS became mandatory for any subsidy provider. So it is interesting realizing that was coming up, how each local workforce board chose to spend the quality dollars in 23 and 24. So if we look at your local workforce board area, you can see these titles below. Those are the big categories. And so we can see the differences here that, wow, you spent more funds in 2024 in infant toddler category. So there clearly was a need seen to spend money in that way. Professional development, not much of a change there. Whoa, Texas Rising Star support, huge change. So
I
you
know.
went from
Well,
spending
yeah, if they want that with
71% of your quality dollars in Texas Rising Star support to 29%. Where did those funds shift to? Well, we can see that some of it shifted to infant toddler, but a whole lot of it shifted over here into the other category. What is the other category, you ask? What are the details of the things that are in Texas Rising Star, you ask? We will get to that in a moment. So we're going to talk about some of the subcategories. But first, let's look at how Alamo compares to the statewide averaged out expenditures in 2024. So on this slide, Alamo is the red column and the state is the gray column. So you can see how you compared with the state overall. We can see that infant toddlers about the same. The state, the professional development category was higher than Alamo. We can also see that the state category was higher in Texas Rising Star. And importantly, we can see that in the other category, Alamo was very much higher than the rest of the state. This is interesting because the biggest difference, the biggest change in categorical expenditures at the state level across all workforce boards, almost all workforce boards, is in the other category. And so even though this 35% of overall state dollars being spent in the other category is a huge amount, and in most of the slides, there's not quite that much of a difference between the workforce board and the state because the state's was already so high. So this is something to pay attention to, Alamo. You guys, whatever's happening here in the other category, you must have felt like it was really, really important to invest in this way. So let's dig into what that could be. This is just an opportunity to look at all of the 28 local workforce boards. The icons tell you like what of those bigger categories each workforce board allocated funds to. It does not tell you how much, it just tells you that there were specified funds in those areas. Alamo is in red. We can see, for example, we've got TRS supports, professional development, infant toddlers, evaluation assessment, other, and national accreditation. You can see that some local workforce boards really focused in on just a few of those categories, other workforce boards more. One is not right or wrong. They're just different ways that each local workforce board felt would be most responsive to the needs of their area. So let's look at the TRS supports. The subcategories here include materials and equipment, curriculum, outdoor learning, which is usually like equipment, outdoor equipment, TRS mentor salaries, family engagement, and TechPEDS SME. TechPEDS SME is Texas Early Childhood Professional Development System Subject Matter Expert. It's a mouthful. That's what that stands for. We know that although that's not an icon that's showing up here, we do know that almost all workforce boards did have support in this area, because as all of the subsidy providers are entering onto the TRS system, and TRS requires that programs engage with the TechPED system so that professional development hours are able to be documented and career pathways can be reflected. That was an additional support that was needed. So it may not have been categorized specifically in this area, but there likely were some efforts to give that some extra attention. Infants and toddlers, you did spend some additional dollars in this area, and you spent it in the area of curriculum and professional development. This is important to note because your professional development, that overall category, is a little bit lower, but you also focus professional development specifically on infants and toddlers. What this tells us is you're combined, it may be pretty similar to what the state spended overall average. Your area just specifically said, we are investing in professional development that will impact the care of infants and toddlers that are going to be like specific to that. Speaking of other professional development, we can see that Alamo dedicated funds in this area to training, conferences, and CDA support. You know, there's a lot of ways to support professional development. Other ways include TRS orientation, college scholarships, and apprenticeships. Do note that just because it's not noted on this area doesn't mean that it's not being somehow supported in your area. It just means it's not happening in a targeted way through these funds, through your local workforce board. But there may be other ways that that's showing up in your community. And so those are conversations for you to have. Here's that other category. What in the world? 71%. Let's see, or whatever that percentage was. I don't think it was 71%. That was a high percentage. What was it? We want to make sure we grab onto that.
It was 57.
57%. Thank you. I want to tell you wrong. 57% dedicated to other category. It was huge. It's wage supplements. And was interesting enough that I went back to go pull this for y'all and see what was the wage supplement specifically. And I want to let you know what those are. It included retention bonuses for over 800 individuals once they reached Rising Star programs, monetary incentives for over 286 staff who had received some initial credentials, monetary incentives between $200 and $4,800 based on a matrix that were awarded to about over 5,500 individuals, and then monetary assistance or incentives to 181 childcare staff that had received initial certification based on the STAR level assessment. And so it was like $75 for 3 stars, 150 for 4-star, 75, 150, and then 300, depending on the STAR level. So what's interesting to me about that is just how it was so tied to quality and the level of quality that there was that matrix, and it just looks very purposeful and well thought out. So way to go, Alamo. Hopefully you also recognize that you saw that too. Either you experienced it, you heard about it, or you were able to see other people being able to experience that. Other things that fall in the other category include pre-K partnerships and investment in childcare management systems. Access to quality care. Here we're going to look at the Texas Rising Star levels. The gray is 2023 for Alamo, and the red is 2024 for Alamo. And what we can see here is how did the number of programs who are at each star level change between one year and the next. The star level at the very bottom is star level 2, and we can see there was an increase. Actually, we can see right away that there was an increase in all of those star levels, with a very big increase happening at the 3 and the 4-star levels. So congratulations, Alamo. That was really good. It looks like a lot of people probably came immediately into that 3 or 4-star level. Now the question is, what are your goals for next year? Are your goals are you bringing new people on? Are you helping people go from 1-star level to the next? Is the goal that people maintain that? You want to know that, whether it's your own personal program, your community, or a set of programs that you're working with all together. And it's probably some of all of those, and maybe even some additional things that aren't included there. Paving the way to quality, we created this report and it was published not too long ago. You can grab the full report at this QR code. It gives you a much deeper analysis of the quality, some of the quality information that we just covered. It also there's a pull-out report for the Alamo Workforce Board, so you can get a lot more detail in there. And also, if you're curious, it gives you access to all of the 28 local workforce boards detail. So there's someone close to you that you're curious about, or another large community. So now we want to hear about what you think when it comes to quality. So I'm going to pull up a poll here and ask you to answer the poll question. You're also welcome to put questions or comments in the chat or to come offline.
I did put the links to the full report and the local analysis in the chat, so if you want to grab those, you can too.
So Kim, what did you think about that quality portion when we were pulling all that together?
So yeah, it's, last year when we did this report was the first year, and so it was just like a, baseline. Where are our quality dollars going at all the different local workforce board levels? And so this year, what was exciting was looking at the year over year and how did boards change. And you guys saw that obviously in Alamo. and then, so just like addressing the needs, like if a workforce board bought a lot of curriculum one year, you would think they wouldn't need to buy curriculum the following year, right? Because we all know it goes in stages, but for the most part. So just seeing how boards adapt was very interesting. And I think the other thing was the other category. Just seeing, we knew the ARPA dollars were ending in 23, and so all the wage supplements and the extra dollars ended then. And so the boards, lots of the boards, including Alamo, picked up, some of that lift. It wasn't the full lift because it was a lot of money. But to do those supplements. And it's not the solution to compensation, but it is thinking about what the solution could be. So excited to see what that looks like. And Alamo wasn't alone. Saw that across the state of workforce boards really focused in on that area.
I'm going to go ahead and show the results here. We have about a little over half of you that have had a chance to respond. So we can quickly take a look at the blue here. It lets us know which of these were you consider to be the biggest barrier in the Alamo area. Obviously, we see salary and benefits coming up at as the biggest barrier in your area, very similar to what other workforce board areas have indicated so far as well. Next on the big barrier list is, looks like it's the quality level of applicants, that's a challenge. And so, investing in retention and wage supplements relevant to quality seems important then. Next, we've got overburdens with administrative work and paperwork. So interesting. Kim's going to talk later about a child care survey and some results for that. And that really connects to some of those results. And pretty close to one another are the last two licensing related issues: turnover of representatives, access to information, and then quality or access to professional development. So those are important pieces and things for you to talk about in your area. Are there any additional comments or questions about the quality portion or some of those results? Okay, well, I am with that then. I'm going to turn it back over to Kim to talk about Child Care Desert data.
All right. Thank you, Lynn. And again, if you guys have questions, feel free to drop them in the chat as we go through. So we're going to dig into the Child Care Desert data. As many of you know, we have been looking at deserts for almost 10 years, since 2017. And so over the years, we have really consistently looked at three areas: our overall child care deserts, our subsidy, and our Texas Rising Star. And this year we've added a fourth layer of looking into that. So when we think about the overall deserts, we look at all licensed childcare in Texas, and we look at all children under the age of 6, where all available parents are working. So that's our landscape. So that's when we say overall childcare deserts, that's what we're looking at. When we drill down to subsidy, we have now filtered for low income families. Again, where there's at least 30 kids in that zip code area, and that 0 to 5 population, and then that low income, and where there's a gap of 3 times the number of 3 times the number of children than there are available seats. And that's what constitutes as a desert. Texas Rising Star is narrower than that because we're looking at quality and making sure that we are looking at those programs that are deemed Texas Rising Star. Now that we've had longitudinal data, and now that we are far enough away from the pandemic and where we saw a big dip, we have added a component of looking at chronic childcare deserts, and those are those deserts across all 3 of those specifications that have been a desert for 3 consecutive years or more. And so that's where we really think about the longitudinal effects of deserts on our early childhood workforce, our early childhood development, as well as our overall workforce. Okay, so let's dig into overall. So this is the overall picture. What's on your left in the gray is Texas, and what's in the red is Alamo specifically. And again, this is the Alamo region. So it's not just Bexar County, it's the full Workforce Board region. So across the state, we saw an increase of about 3,000 seats across the state, but in Alamo, we saw a decrease of overall childcare seats of about 1,100 across the region. And so we have about 44 zip codes in the Alamo region, which is 3 more than we had the previous year. Across the state, we were at 413, and last year we were at 420. When we look at the subsidy lens and we look at the low income lens, that obviously it's much smaller, and we saw a little bit of an increase in seats for subsidy in the Alamo region, but we also saw an increase of deserts. And so when we see those numbers going in the same direction, we always pause and kind of go, okay, what's going in on that? Because if you think we increased seats, then our deserts should get smaller, right? Is the typical rule of thumb. But when we really dig into what those nuances are, there's a couple reasons why we see this in our subsidy and our Texas and our quality, our Texas Rising Star deserts. And there are 3 main reasons. One, there was a zip code that wasn't deemed a desert last year. They didn't meet the number 30 kids or more. And their supply didn't was non-existent or grew very little. So a zip code that wasn't a zip code last year, or wasn't a it was a zip code last year. It wasn't a desert last year, is a desert this year. Another reason is just the demand outgrew the pace of growth in those regions. So it was, and then the third reason is simply supply loss. We lost childcare providers in those regions. In the Alamo specifically, the increase in deserts can be really attributed to 2 of those things. The first is the increase of we had increased the number of kids of low-income working family in the region, and the second is about only 53% of any of those new subsidy seats went into an existing desert, which means that that supply was added, but it was added in communities that already had enough childcare. And so we want to make sure that when we're thinking about where do we see that growth, is it growing in the right area? And lastly, 8 zip codes from that were previously unclassified as subsidy deserts have enough children this year. So that specifically played into those 2 areas and 2 reasons. When we look at Texas Rising Star, that gets a little more narrow, right? So, so you can see that we have an increase of, we increased our number by 4,000 kids, which again just means those providers that were subsidy last year are now Texas Rising Star. So they were now deemed quality seats, and which means we only saw an increase of 1 zip code. Again, where that growth isn't matching where the deserts are, which plays into that piece. When we look at our new category, our chronic, this shows us the specifics for all 3. So we go from overall subsidies in the middle and then Texas Rising Star on the right. So 21 out of the 44 deserts overall in the Alamo region are what we consider chronic or have been deserts for at least 3 years. So that's 48%. In the subsidy, that is 46 out of the 80 subsidy deserts, so that's 58%. And then our Texas Rising Star programs is 54 out of the 84, which is about 64% of the deserts. And what we really worry about and think about in those situations is if you think about a child's life, if they stay in that zip code, the entire their entire early childhood, that 0 to 5 years, 3 years out of that is a big chunk for their own development and their own brain growth, as well as for that family not being able to rely on quality childcare for them to be able to go to work and find that sustainable job on themselves. So we know that is a huge chunk that we're really thinking about and how we can make those areas better. We can now look longitudinally, and so this is the last 5 years. And so in 2021, you can see that that dip we were coming out of out of COVID. We saw that big increase in 2022, and then we have kind of leveled off to kind of where we were before the pandemic. And so that top line is overall seats across the state. This is how many seats do we have per 100 children in that 0 to 5 space of working families. And so overall, we have 86 seats per 100 children across, which is pretty darn good. Like we're doing well, right? We know not all parents want formalized childcare. So we think, yay, great. But then when we look at the our low income and our TRS lines, which is that middle and bottom line, where we have a long way to go. So we're only looking at almost 26 seats per 100 children and almost 23 seats for Texas Rising Star. So we still have a long way to go to meeting the need for a childcare for our low income. The next slide is one of my favorite slides because it's just exciting. This shows how many participants do we have of providers. The left side is the providers participating in Texas Rising Star. Before we moved to mandatory TRS, that number was hovering around the 30% of our providers that were taking subsidy were in Texas Rising Star. That number is now at a solid 76% across the state and for the Alamo region, which is fantastic that we're continuing to see that steady incline. On the right side, this is a question looking at the children, right? So out of the children that are in subsidy, in the Alamo region, almost 85% of the kids that are in subsidy are receiving care in a Texas Rising Star program, which is phenomenal. That we have, that much of our children are in a high quality program across the state. The average is right at 83, 84%. And so you guys are doing just a skosh above average in the state.
Kim,
yes, ma'am.
Can I interrupt you with a question?
Sure.
Like to know how low income is defined when you're talking about low income thresholds.
Oh, that's a good question. So we use what the 200 below 200% of the federal poverty line is what our measurement for low income is. That's a good question. That moves, right? Some people use the poverty line, some will use the state median income line. So yes, good question. So when we also have been tracking family childcare and knowing that they are an integral part of our early childhood landscape. They are important for families, especially infants and toddlers who want a smaller environment. We know that they are more likely to offer non-traditional hours, so families that work early in the morning, late at night, or on the weekends. And so they are an important part of our ecosystem. And so we've been tracking how they have been doing. They have not bounced back from the pandemic. We are still looking at a 22% decrease of family childcare providers since 2019, since before the pandemic. We have inched up a little bit this year, which is good, but we still have a long way to go. So we still want to make sure that they are a focus of our work. And then when we think about the number of kids, and we get this question a lot from lawmakers of how many kids can we serve and how many kids need to be served. When we look at that low income kiddos, which is where our public dollars go, and we think about that 0 to 5 space, we are serving about 26%. So 1 in 4 children of low income working parents have a subsidy, have a scholarship that they can receive from TWC. So not nearly enough that we know that we can do a lot better with more funding and around those pieces. So before we jump to the poll, Lynn, if you want to stop sharing, I want to show you the map because we've added a couple of features this year. So this is our childcare desert map on our Children at Risk website. You can click on View Map. It takes a second to load. I just want to play Jeopardy music during this time. There we go. And so one of the things we've added this year is we've added this box here on the right that lists our chronic childcare desert. So you're able to see across the state overall, we have 413 deserts and 263 of them are what we would consider chronic, When you look at the map, you can also see there are deserts that are outlined in that darker line, and those are the visualization of where those chronic deserts are. And up here, you can see this teal colored um, button, I guess is the word for it. If you unclick it, your chronic desert designation goes away, and so you can include that or not include that. Some other features you can add is you can view childcare providers, which will give you a heat map of where those providers are. You can, these are just the Texas Rising Star 4-star. You can look at NACCE accreditation. You can look at CACFP, which is our child adult food program, or not CFP. So you can make that and filter that however you wish. You can also choose your boundaries. So here is the workforce board areas. And I will put in Alamo. There you are. This is the Alamo region. And then that outlines the workforce board region, and then you can visually see the deserts. Up here, you can also toggle, these are your totals. Then you can click here for your subsidy and looking at specifically for low income. And then you can look at your Texas Rising Star as well. And see those designation. And we can see that these numbers change as well as when you go across the different designees. And then you can also click up here to the overtime and see your own personalized lines and look at how and track across the board. And then you can also, there is a data download button here that if you want to dig into your specific community, you can do that. And you can, there's also county designation, so you can do Bexar County. You can also look, and let me show you the map for Bexar County. You can also do it by zip code. So depending on what you want to use that data for, you can drill down and understand where that your community a little bit more. You know, we get excited about our desert data every year and looking in to see how the state does, and it gives me great information as we talk to decision makers and legislators. But what really gets us excited is when you use it at the local level, because you guys know those communities more than we do, right? So you can look at a zip code and go, oh yeah, that's the reason why that's a desert, and list off, or why it's a chronic, or scratch your head and go, I wonder why they're a desert. But you guys have that local context that we don't necessarily bring to that table, and so we are super excited for you to all to dig in and look at that data. All right, Lynn has another.
I do, and I'm going to launch this poll, and also Kim alert you to a question. When you're selecting those filters and select to download data, will the download provide those filters with only those only those that you selected?
Correct, right. So when you are in those filters, if you just are in Bexar County, then when you download that data, it should give you just the Bexar County data. And then, you know, however you slice and dice your data. So yes. And if you have issues with it, feel free to reach out to us, and we can help along the way as well.
You all might remember when we were out doing Texas Tour in the fall, we kind of teased the chronic childcare deserts. And so it is new now that you can go on to the desert portal and look at the specific Alamo area and to what degree you have chronic deserts by zip code, or however you want to tease that out. Kim, what is the best way for people to reach out with questions?
You can reach out to Lynn and I with our email, our phone numbers. Yeah, just shoot us an email and we can set up a time to talk, or shoot us your questions. And if we don't know the answer, we can reach out to our data team to help dig in. 100%.
Okay,
okay.
Oh.
So when we're looking at the access to, looking about our barriers, cost of families, right? It's hard to it's your number one pick when you add those top two barriers. First, the biggest barrier and the second barrier is our biggest barrier, and that second follows closely behind cost of doing business, which surprise, those two things go hand in hand. So how do we make it more affordable for families? How do we make it less expensive to run the business? And what kind of supports can we give? Not enough staff, that's obviously a big one. You can have the big, beautiful buildings all you want, but if you don't have teachers in them, you can't take care of the children. So how do we leverage both of those things? And then location is another piece, right? So for sure. Okay. Any other questions on that? All right. Let's go back to the PowerPoint. And we're going to dig into our final area, which is around advocacy. And let me get my screens right now that I shared screen. Oh, come on. All right, here we go. All right. So let's get into the advocacy. So just kind of level set us. We have, there we go. So for access, we know that 47% of all of our zip codes across Texas are deemed a childcare desert for low-income children. So we may overall have enough childcare, but we know they're not in the right locations for families. And we also know that for our low-income families, they have a much harder time finding childcare than our more affluent families. We know families are spending a lot on childcare. For infants and toddlers, they can spend anywhere between 10 or 50% of their annual income on childcare. The national recommendation is around 7%. So we know those things are not in sync. And we know our early childhood workforce is 6 times more likely to live in poverty than our elementary or middle school teachers. And 43% of our early childhood educator households participate in one or more a form of public safety nets or programs across the state. So you guys have seen my tricycle before, or some of you have. I've made a couple additions to it. So, but when I try to think about the systems of early childhood education and how we explain it to people who don't live it every day, or sometimes decision makers just want to focus in on one part of it and then and not the other, and so it still hasn't fixed the problem. And so it's a system, right? It is a machine of that's either working well or not. And so I use the analogy of a tricycle because we're early childhood people. And so that first wheel is around brick and mortar, and that's what our deserts look at, right? Our deserts look at number of buildings and seats compared to number of children. And which is a factor of those of our system. We got to have buildings and programs. But if we don't include that front tire, the early childhood educators, those buildings can sit empty if we don't have the educators to go in them. And so we need to make sure that we're paying attention to our educator workforce and those people that are caring for our children just as much as we are the brick and mortar. And affordability, if we have all the beautiful buildings and we're paying our educators what they deserve and what they need, we're going to be really unaffordable for families, and no one's going to be able to access us. And so, how do we keep those three things in sync and support each other, and making sure that they're aligned so we can have a working tricycle? The frame of our tricycle are all of our rules and regs. So those are all the systems that we work in tandem with or in silos, which we'll show here in a second. But those are what keeps that framework in alignment. And the funding mechanisms are really the pedals. It's what moves us forward or stops us in our tracks if we don't have enough funding in the system. And so that's where we really think about that tricycle. And then we're each in the driver's seat, helping to move that tricycle forward. So what does that system look like in Texas? And in Texas, we are across 6 different state agencies is our tricycle. So when you think about those rules and regs, that framework, we've got rules and regs coming in 6 different entities at us. So the first one's Health and Human Services. That's where our child care regulation sits. That's where our early childhood intervention or ECI program sits. and lots of other family supports. Department of Family Protective Services is where our child abuse and neglect statewide intake sits, also foster care and kinship care. Then we have Department of State Health Services, which is where our maternal and child health, Help Me Grow, and also our immunization tracker, because we're keeping, up to date vaccine information. A lot, if you're a center director, you're dealing with dishes. Then we have the Texas Workforce Commission. So if you are participating in the subsidy program in Texas Rising Star, that all is housed at the Texas Workforce Commission. Then we have the Department of Ag, which houses our child and adult care food program. And then we have our Texas Education Agency, which is if you have pre-K and pre-K partnership or children with special needs and over the age of 3, you're going to be working with your ISD and TEA. So as a child care program, you're dealing with all of these entities as a family, navigating these systems for what's best for your children. All of those things make a difference for our children. So as we came out of legislative sessions, what do we do with all of that? There are 3 things that are happening right now that we want to keep our eye on. And 2 of them were passed in the last legislative session, which was House Bill 117, which created the Governor's Task Force for Governance of Early Childhood Education and Care. It's really charged with looking at how do we align these 6 different agencies? What's the best way to govern this to make it better for children and families? How do we make it better for child care providers? How can we make this more that tricycle more aligned? House Bill 4903 established the Quad Agency for Child Care Initiative. It's really focused on those rules and regs. Where are those rules and regs aligned? Where are they duplicative? Where are they contradicting? Where are trainings for staff not aligned? So where are those things that are across the board? And then we have our Sunset Commission, which is a standing agency here in Texas that their job is to look at all different state agencies on every 10 to 12 year rotating basis. This year we have Department of Family Protective Services, Health and Human Services, Department of State Health Services, and TWC, Texas Workforce Commission, all going under sunset review. So all of these things are happening at once. And I jokingly say, we have either the stars are aligned or we've made all the gods mad. I'm not sure which, but we have a moment in time to really make a difference in our early childhood system with all these 3 things happening. This next line just briefly shows you all these things, all these entities and which agencies they affect. So with that, we really thought about how do we bring provider voice and bring family voice to this work. Oops, sorry, I clicked too fast. So last fall, we did a survey. We had 1,300 providers across the state and parents give feedback. It represented all 28 local workforce boards. During Texas Tour last year, we asked lots of questions and did some town hall conversations around what is needed and what changes. And so we compiled a report that link will take you to based on your recommendations. So here's the breakdown of who participated in the survey. 90% of you all were child care providers. So if you took that survey, we thank you. We know there was a lot of surveys the last couple months as we're all trying to gather important data across the board. So what did those surveys really tell us, and what did we learn from those? And so we have 6 kind of overarching recommendations that we are really trying to think about when we think about the different opportunities that we have during the interim. So the first one's really around governance and system-wide coordination, and really how do we design a purposeful, unified governance with system-wide coordination to improve efficiency and quality. We need to identify a person, an entity, an agency with decision-making authority that's looking at all the programs so we can streamline them for children and families, and we can streamline them for our providers out there. How do we make it a more to improve efficiency and effectiveness? With efficiency, we also need to think about our local workforce boards, and improve the efficiency of those, of how do we think about their service areas are better, can they be better aligned to meet today's population, community needs, and economic realities. They were designed 30 years ago, and with their board structures, and their geographical areas, is that the best way to meet the population and the needs of those communities? One of the things we heard from the survey was really this: rules are constantly changing, or one licensing rep will say one thing and another one will say another, or licensing comes in and TRS comes in and says a different thing. And so how much of that is in standards, and how much of that is in training that we need to really affect? So how do we build a system that's more cohesive, and really builds and complements each other? The next one is really around application and access streamlining. So really thinking about families as that intake and referral system. How do we develop that piece? One of the things we heard providers describing challenges of how do we access and maintain services for families. How do providers said they spend the majority of their time on compliance rather than serving children. Conflicting eligibility information and requirements. Some are as of April 1st, some are as of September 1st, some use the 200% federal poverty line, some use the state median income. So what are those things that we can align and do better for children and families so they can have a better understanding of what's all available to them? The next one is really around that regulatory and implementation alignment, really, again, thinking about the excess of paperwork, duplicative documentation. I was talking to a provider a couple of weeks ago who said she was filling out technology compliance, fraud prevention stuff for 4 different state agencies, all using different forms, not using the same, like asking the same question on their computer, safety nets and so forth, to make sure their data systems had the firewalls, et cetera. And she said, can't this just be one form that goes up? So like those are the things that we're talking about of how we can really streamline those. Inspectors who apply the rules unevenly, some are supportive, some are punitive, some are inconsistent. These are all things that we heard from our survey. So how can we synthesize those key regulations to reduce confusion and improve regulatory alignment? So what are the ways that we can really think about that? The last 2 are around contracting, accountability, and performance management. And then the last one's around access for children with disabilities. Around contracting and accountability, this theme surfaced across the survey, especially in connection with the child care services reimbursement delays, the rollout of Texas 3C. So we heard that loud and clear this last year, which is no surprise, I think, to any of us. So the voices, the field and the providers were really asking, how can we hold all of us accountable, not just the providers, but how can we hold workforce boards and the state and the vendors all accountable for those systems to make sure that we are being accurate and transparent in how those all work. For children with disabilities, again, this is something we hear not only in the survey in Texas Tour last year, but in tours for years, is how do we make improve access for children and services for families with children with disabilities. We know there's a differential rate for children with special needs. That's not always easy to get for children and families. How can we make that transition from ECI to public schools easier? How can we get a family who's finally ready to get their child evaluated? How can we make that easier for them? So it really goes into an array of issues around children with disabilities. There was a bill that was passed last year, House Bill 2310, that has asked TEA, Health and Human Services, and TWC to develop a strategic plan around it. They have a survey that is out now that is open just until the end of this week. So if you have thoughts or feelings or ideas, please take 10 or 15 minutes and fill out that survey. This is going to TEA directly and will be used to develop their strategic plan. So please share this link with others in your community because we really want them to have a good representation of that survey over the next couple weeks. Thank you, Lynn, for dropping it in the chat. So that way they can really get next couple days so that they can really get a good information and really build a strategic plan that can really benefit children and families. Okay, that was a lot. So a lot going on in what we call this interim period. So what questions do you have? I think Lynn's got another open-ended poll question really about like how do these recommendations sit with you? Things that get you excited about, things that questions that arise, things that give you concern, things like yes, please fix this, or don't touch that. Where are you on that piece? And again, feel free to do the poll question or just drop it in the chat or come off mute. Lynn, is there an answer in the chat? Oh. Lynn, can you see the answers? It's asking me to sign in again. I don't know why it does that to me.
I can. We have, do we know when LMO will be opening up funding for families needing subsidized care? And
That's a good question.
Love the alignment piece. Those two things.
I don't know. Does anybody on the call know about Alamo's wait list and more scholarships?
We're doing a very small intake right now. It's only about 300 children. And so it's only going to touch some priority groups.
Great. Thanks, Jessica. Small intake's better than no intake. Dr. Landry, did you have a question or comment?
No, Jessica, of course, answered it. I was going to provide it, but Jessica, of course, took care of it.
Very good.
Miss Stephanie, I see that you got cut off in the middle of your response. You want to come tell us what you were thinking about the policy advocacy piece? It was a different topic. Stephanie, we'd love to hear from you no matter what.
Or you can drop it in the chat too, Stephanie.
Okay, it was on a totally different topic. It was about the childcare deserts. Is there a list available that really defines the deserts and where they're located? And I meant even the new desert that was now categorized. How do we find out? Because at one time I was a desert, then I was told I wasn't a desert, but how do we get that information?
Yeah, so on the interactive map, you can like actually put in your zip code and find out where that desert is. It is important to note that our deserts are defined a little bit different than TWC's. So I know, like during the ARPA funding, there was like they had their own destination. We do a 0 to 5 desert. They look at their deserts through school age, so there's a little bit difference there. But the answer is go onto the map and you can search by zip code. Good question. Thank you, Stephanie. All right. Any other thoughts, comments, questions? Okay, we've got three QR codes, and you guys are gonna, again, like Lynn said at the beginning, there is you'll get a email follow-up that will have a link to the recorded webinar. You'll have a copy of the deck, and you'll have links to all the things that we shared. But here's 3. So you can, the left one is our QR code to our maps. The middle one's our Paving the Way report that I shared the link in. And then the one on the right is to sign up for our Children at Risk ECE updates, and which you'll get your newsletters and updates for events coming up. So those are all 3 resources. So, well, we didn't wait enough, Lynn, on those responses. Sorry, everybody. So, yeah, exactly. I agree with you, Sydney. So, all right. Well, with that, thank you so much for being here. San Antonio, this is probably one of the biggest groups we've had. So pat yourself on the back for being here and getting the word out. We appreciate you. And we will be in touch soon with, we have upcoming summits and then we'll be out in person this fall. We'll be in San Antonio with you soon. So with that, have a great rest of your day. Hopefully the sun is out where you are. Down there, it is cloudy here in Austin, and we'll see you soon. And if you have any additional questions, feel free to reach out to us.
Thanks, everyone.